Hi, my name is Hayden Brown. The topic I was given was Children's Health Insurance Program, also known as CHIP. CHIP is a health insurance for children whose families that had enough money to make them not eligible for Medicaid, but not enough money for them to get private insurance. While searching the Ohio Medicaid and CHIP website, I came across a graph that says for children that are between the ages of 0 to about 18, their eligibility level would have to be around 206%. The first article that I got was the politics of children's health insurance policy. They really talked about CHIP program, some of the information that goes along with it, and some graphs on how people have used it. Some information I have learned from it is that CHIP is among the most significant expansions since Medicaid in 1965. In 1997, the federal government allowed $40 billion for a new children's health insurance program. The Federal Balanced Budget Act was one that helped create the Children's Health Insurance Policy, or CHIP. CHIP was a federal sponsorship program, but it was given control to the state. They suggest that the Republican political strength has a negative influence on CHIP spending. Connecticut had a Republican governor for a 10-year span from when they were doing the polls and surveys, and the measured amount of CHIP spending was was one of the lowest average CHIP rates, and it came around to about $650. They say that with the older residents, the spending of CHIP is less, and there are states that have a high cost of living have more CHIP spending. There's studies that show that the racial inequality reduces the amount of CHIP spending and how much they get. While looking into it, CHIP is a federal means tested public benefit, and with the immigration reforms provisions states that when a state creates a separate CHIP program rather than expand a Medicaid program, they do not allow legal immigrant children into it. And as of May 2020, Ohio has enrolled about 2.7 million individuals into a Medicaid or CHIP program. The second article that I got was called Parental Eligibility and Enrollment in State's Children's Health Insurance Program, or CHIP. Parental eligibility was higher in households without a full-time employed parent. Roughly 1/3 of eligible parents did not enroll because were not aware about their eligibility. Despite much research on the importance of parental eligibility under the CHIP, little is known about which parent actually enrolled in the program. If the family income was above 200% of the federal poverty rate, their child would enroll only because the parent would not qualify. If parents were employed but temporarily not working, their children was disenrolled at the time of the survey. The information all this came from is from a 2003 New Jersey Family Care Survey, and they had a sample size of about 416 people. Half of single parents and 3/4 of two-parent families with at least one full-time parent had either a 1 or 2 chance of parents eligible for the family care. Some of the limitations they had were that the sample size was smaller and it did not capture the families who were not yet eligible. A lot of parents did not enroll into the family care, and in 2009, the CHIP RA Children's Health Insurance Program Reauthorization Act states that no new states are allowed to cover parents under the CHIP, and states that do cover parents will start to transition their cover into a separate grant program. While searching the Ohio Medicaid and CHIP website, I came across a graph that says for children that are between the ages of 0 to about 18, their eligibility level would have to be around 206%. While looking into CHIP and all the things that I have read about it, I do believe that it goes with the code of ethics for social work. Like, the core values of social workers are to help people and children of all kinds, And with CHIP, it is a program to help children get insurance so they don't have to worry about the payments or anything like that, and they can be insured no matter what.